The bravery displayed by our service members at war is commonly recognized. However, often forgotten is the courage required by veterans when they return home and suddenly face reintegration into their families, workplaces, and communities. The repercussions of combat duty can often lead to difficulties such as post-traumatic stress disorder, anxiety, depression, and substance abuse. It's an all too common problem that's creating a growing need for a comprehensive approach to the treatment of combat-related emotional disorders. A significant number of our service members redeploying have post-traumatic stress disorder, or PTSD.
PTSD is a psychiatric disorder, and as well as with a surgical issue. Cut hand, the sooner you get treatment started, the better the outcome.
This is the Haven Behavioral War Heroes Hospital, a full-service inpatient facility located within St. Mary Corwin Hospital in Pueblo, Colorado. A comprehensive psychiatric treatment hospital, it is the vision of retired military Colonel Dr. Harry Silsby, a decorated veteran of the Vietnam War.
As long as we've had armed conflict, we've always had acute combat stress. Our mission is to create an environment that we can treat soldiers better than any place else in the country.
Staffed by a skilled team of nurses and medical professionals, 70% of which served in the military, the Haven Behavioral War Heroes Hospital is designed to treat the emotional damage of service and help service members learn to relive and recover from traumatic experiences.
If you just get soldiers together with like experiences, that's therapeutic in itself. At Haven, we can treat a wide variety of psychiatric disorders. We primarily concentrate on post-traumatic stress disorder, but we also treat co-occurring chemical dependency disorders, depression, mood disorders, anxiety disorders, psychotic disorders, and adjustment disorders.
The Haven Behavioral War Heroes Hospital uses a 28-day stay program, offering a full array of treatment modalities, including cognitive behavior therapy, cognitive processing therapy, individual psychotherapy, medication management, detoxification, and around-the-clock nursing supervision.
What we do primarily here is we have two tracks, a 28-day track for post-traumatic stress disorder and a 28-day track for chemical dependency disorders. And it's interesting that the two illnesses coincide. Approximately 70% of the soldiers with PTSD actually have chemical dependency problems. So we actually put these folks into both tracks and treat both of these conditions. We do some psychopharmacology, which I attend to primarily, and see all these soldiers every day for medication management. We have them go to physical training, because if you do 20 minutes of cardio, that really slows down your nervous system, and anything we can do that's inhibitory on this hyper-excitability state that these gentlemen are in, and ladies, then we need to do that. We have a number of other classes and psychoeducations. We do some biofeedback, we do anger management, we do a lot of family therapy, and that when these soldiers come back from deployment, it is very difficult, it's very disruptive.
We offer a wide variety of classes that teach things on, let's say, depression management, anxiety, sleep disorders, a lot of education just to familiarize the patient with what they need to do to decrease their symptomology. It's learning how to live with your trauma. It's learning how to deal with your trauma, be part of your trauma rather than being a continued victim of your trauma.
One of the first residential programs of its kind, the Haven Behavioral War Heroes Women's Program is a comprehensive military inpatient program open to active duty military women across the country. An intensive 28-day inpatient track with strong emphasis on trauma work, it provides treatment for women suffering from military sexual trauma, or MST, post-traumatic stress disorder, and other service-related psychological traumas.
A significant number of female service members have had sexual trauma, and they have special needs. And that's what we're trying to set up a program to address their special needs and make the program tailored more to fit that type of trauma.
Our main modality of treatment is cognitive processing therapy, also known as CPT, and it is designed to actually help process the patient through their trauma events.
The Haven Behavioral War Heroes Women's Program also offers initial and joint counseling, daily physical training, personal skills training, and emotional awareness.
We have to teach the women how to re-regulate their emotions. We have to explain to them how to learn how to breathe again, to relax again, to be able to think again, to be able to control their lives and to ground themselves and to be a normal functioning part of society again.
We get very positive feedback from commanders, behavioral health assets at the various bases, and we get additional referrals. And to me, when you get the second referral from a behavioral health clinician, it means that you've struck a chord and they see what you've done has been valuable for their service member. It's also anecdotally, we certainly have had very positive feedback from the people who have gone through this program, as well as family members that have been involved in the program with them.
Since I travel nationwide for the company and I'm seeing case managers, physicians, etc. throughout, the feedback I get is awesome, and they're just really, really, really impressed with our services. The Department of Defense has had a 10-gallon job with maybe 3 gallons to do it with. They don't have the resources to do this. So we need to step in and help.
We've had some real success stories. One young man said, you know, when I came, I didn't think I could make it in the service anymore. And after going through treatment, now I want to return to duty and do my job. We've tried to validate our program. We do a PTSD screen when the patients come in and then when they leave. And we find about a 30% improvement. We've also submitted this as a publication to Military Medicine. We just recently had an article about our program in Army Times.
This is a program that was designed by a former military for active duty military. It's very gratifying to see the end product of hearing stories of little vignettes when a patient comes to us and the place they're at when they're discharged. And we know that they're not fully recovered, that there's a great deal more work to be done through outpatient. But it does feel good to know that you've helped them at least make the first step in recognizing the problem and learning how to deal with it. We know they have a lot of work to do when they leave here, but we think we've given them a good foundation to start with. We just think it's a better way of providing the level of care that these people are entitled to.
The Haven Behavioral War Heroes Hospital, giving service members the tools needed for their challenging journey. For more information, go to havenbehavioral.com or call the number on your screen.